The simple facts are that in light of the government's own data, COVID vaccinations and boosters are not effective, and from the evidence of the yellow card system, they're not safe, and to the UK taxpayer, they are not value for money. Indeed, given the side effects, Mr Deputy Speaker, if they were free, we couldn't afford them. The only ones who really benefit from the booster rollout are Big Pharma, with their licence to print money and indemnification against the harms of their products' cause. Once again, Mr Deputy Speaker, Big Pharma have put profits before people, and on this occasion, governments across the globe have been their willing marketing agents. The whole COVID-19 narrative is slowly unravelling. As I believe I've demonstrated today, Mr Deputy Speaker, no one should have been boosted after the efficacy data was received on the 25th of October last year, and no one should be boosted in future based on that data. Given the evidence of harms by the boosters, I now believe that we have the full explanation of both the continuing excess deaths we've seen since the pandemic, 63,000 excess deaths in England and Wales in the last 12 months, and also the reason for the huge and unrelenting pressure of demand on the NHS. Mr Deputy Speaker, it's the vaccines and the boosters and their side effects. Sadly, I am confident that I'll be proved correct. I sincerely wish it was not so. But the longer it takes our government to accept the truth, the more people will be harmed and die. The first step to putting right a problem is always to admit there is a problem. The government narrative of safe and effective is in tatters, as evidenced by their own data. 3 months on from my original speech in this House, we have surely now sacrificed enough of our citizens on the lives on the altar of ignorance and unfettered corporate greed to satisfy anyone. I therefore call on the government to immediately stop the mRNA vaccine booster programme and initiate a full public inquiry into not only the vaccine harms, but how every agency and institution set up to protect the public interest have failed so abysmally in their duties.